And we're back. Dr. Jacques Despetri of Soho MD here at the Bullpen at the JPM Healthcare Conference. And I'm here with John Bonham-Carter of Jaguar Biotech. Great to have you here, John.
Good morning.
So could
nice
you tell
to be here, Jack.
Yeah, could you tell us what got you here?
So I come from London a long time ago. I live currently in Somerville, right next to Cambridge. And I have a company called Jaguar Biotech. I am a sort of, I guess, an entrepreneur, a small-time entrepreneur over many, many years, couple of failures, couple of recent successes. And I'm a board advisor to Evia Bio, which is run by Christian Eggstrom. And this company is got a super interesting concept of trying to replace DMSO in cryopreservation.
Really? Tell us more.
So it's the standard at the moment is this DMSO, which goes into all cell therapies. It actually goes into all sorts of blood banks and all sorts of cryopreservation, including reproductive health and so on as well. But it's highly toxic. It damages cells, but there is not anything else which has been FDA approved. So people are forced down this road. And for a lot of people, it works well. But people increasingly in cell therapy realize this is not the right solution for them, particularly if you've got delicate cells which might be damaged. You might be worried about iPSCs being maybe transformed in some way. You might not have that many cells that you're trying to preserve, and so any death in those cells is a problem. And equally, if you're sort of doing in cell therapy, you might be injecting some straight into the heart, you might be going to the brain, or maybe in pediatric indications, you're going to be very worried about putting a known toxic substance into people.
Totally.
So of course people say, well, you just wash it out, but in that you start to lose cells, and there's a time issue and there's a reproducibility issue. So the ideal is just, well, can't I have a naturally occurring substance that has exactly the same effect? And that's what we're trying to achieve.
Wow. And how are you going about achieving that?
So our founder, Alison Hubble, in Minnesota, she is fantastic. She's a world-renowned expert in this area. And it all derives from sort of quite interesting research on, well, how does nature cryopreserve its materials, right? It clearly doesn't use a toxic substance. And it solves it in a multitude of different ways, as you would expect from nature. But typically, you're using sugars and sugar alcohols, for example, in trees in Canada and the north of the US, that survive extremely cold winters for a long period of time with a high degree of reproducibility, obviously, because everything survives up there. So having learned how that all works and saying, how do we apply those principles to our own cells, to human cells, and by optimizing various components for different types of cells, we can end up with a solution that is often better than the current standard, and ensuring that it's a safer alternative to what's out there.
That's amazing, and you're seeing promising results with what the company is working on?
Yeah, so I mean, today we have a number of customers who are super happy. They often have more than just one problem, these customers, because this is a complicated area. So we might be solving one of their issues on the supply chain, or on the delivery, or on their cell health, right? They might have a viability issue, and we go, well, we can help with that.
Wow.
It may not be the safety profile that is the driver for people. So our team has experts to be able to optimize a protocol and work to make sure that everyone's trained correctly with our solutions, or maybe with alternative solutions to make sure they've got an optimum. But clearly, we hope that people use our solution the most because it is so easy to use and it's not toxic. And at this point, as soon as we get into clinical trials, I think it will expand out of our niche area of people who clearly need us into a wider market and then larger adoption.
Yeah, it sounds like there's going to be widespread need for this.
It sort of sounds
platform.
obvious,
yeah.
Right? But in fact,
non-toxic, still effective, and
right, and also has this nice word we can use, natural, because it was derived from learning about nature. And you can sort of see also, if you look at reproductive health and you go, well, you've got sperm and you've got eggs, and hang on, how are you preserving those guys? They're all in a toxic material that we know is detrimental to human health.
Wow.
And now we're going to be using that to preserve for how many, months or years these critically important cells. So you can see that in that industry, there's also going to be huge adoption once FDA and other regulatory agencies look at this and feel that this is safe for use, either direct injection or is certainly much safer on the cells than it is at the moment.
Yeah, it's a compelling proposition. Yeah.
That's what we think.
Yeah.
That's what we think. So today and yesterday, we're talking to people who've got these problems. We want to be understanding truly what their problems are and making sure we've understood. Often it's a multifaceted problem, and we may not be able to solve it all, but we can certainly help in particular areas. And we're looking for partners who have cell therapies in particular, with indications in those sort of brain, heart, or maybe they're highly diseased patients that can't handle toxic going into there, or people with very delicate cells that are worried about the total number of cells they'll be able to recover once they've thawed their product in a clinical setting.
That's awesome. And what are you working on now?
So as well as Evia, I can't talk about our customers, unfortunately. That's all confidential. But we've got about 3 or 4. We would like to have 3 or 4 more. So we're looking for 3 or 4 partners, not more than that. That would be perfect. And we want to have these partners work with us to get into phase 1. So if they've got issues that they are worried will impact their phase 1, then we're going to be a perfect partner for them.
And what's your ask of the Bullpen community?
So I'm going to flip subjects a little bit. I'm also an angel investor. I'm an investor in Evia as well as an advisor. And I think all people who have biotech tools, I'd be interested to talk to say, can I help as you prepare your business plan, as you think through how you're presenting to the community? Have you understood truly the nature of the problem you're trying to solve? And I often do a lot of consulting for free for that. And it allows people to, I get a lot of enjoyment out of helping people explain the problem they're trying to solve. Because there's a lot of scientists who really understand the science, but they're not always such great communicators about how to explain to the market or to investors really the problem they're trying to solve and how will the world be better at the end of it. And I'm pretty good at that.
Yeah.
And hopefully I've done a good job with Evia today explaining why there's a real need and how we go about solving it too.
Yeah, you've done a great job. So if you want to learn more about John and Evia, you can go to bullpen.ventures. The link in bio will be there. Great to have you here.
Thank you, Jack.
Yeah.